The clock on the emergency room wall showed 2:30 a.m. as Dr. Patricia Williams rubbed her tired eyes. She had been working for 14 straight hours at Metropolitan Hospital, and her patience was wearing thin. The coffee machine had broken down hours ago, and she was running on pure adrenaline and determination. 3 more hours until her shift ended, she thought to herself. As she looked at the growing line of patients waiting to be seen, the automatic doors of the emergency room slid open with a soft whoosh, letting in the cool night air. A tall black man in his early 40s walked in, supporting an elderly woman who was clearly having trouble breathing. The man wore a crisp navy blue suit that looked expensive, and his shoes were polished to perfection. Despite the late hour, he appeared calm and collected. Though concern was written all over his face, the elderly woman, who appeared to be in her 70s, was clutching her chest and breathing heavily. Her son guided her gently toward the reception desk, speaking to her in soothing tones. "We're here now, Mom. The doctors are going to take good care of you," he said softly. His voice filled with love and worry. The reception desk. The man explained the situation to the night nurse. "My mother started having chest pains about an hour ago. The pain is radiating down her left arm, and she's been feeling dizzy and nauseous. Her blood pressure medication is—" He began listing details, but the nurse was already calling for immediate assistance. Dr. Williams heard the commotion and walked over to assess the situation. She took one look at the well-dressed man and the elderly patient and immediately made her first assumption. Another family, probably without proper insurance, she thought to herself. She had seen it countless times before, people who dressed up thinking it would get them better treatment. "What seems to be the problem here?" Dr. Williams asked in a tone that was more businesslike than caring. The man turned to face her, extending his hand politely. "Doctor, thank you for seeing us so quickly. My mother has been experiencing severe chest pain for the past hour. The symptoms started suddenly while she was watching television. She describes the pain as crushing, and it's accompanied by shortness of breath, nausea, and sweating." Dr. Williams barely glanced at his outstretched hand and didn't shake it. Instead, she looked at her clipboard and sighed. "Sir, I need you to step back and let me examine the patient. Family members need to wait in the designated area." "Of course, but I thought it might be helpful if I provided her medical history." "She has a history of hypertension, and she's currently taking—" "Sir," Dr. Williams interrupted, her voice becoming sharper. "I appreciate your concern, but please let the medical professionals handle this. We know what we're doing." The man's expression remained calm, but something flickered in his eyes. He nodded respectfully and stepped back, though he stayed close enough to comfort his mother. "I understand, doctor. I just want to make sure she gets the best possible care." As the nursing staff prepared to move the elderly woman to an examination room, Dr. Williams noticed the man's expensive watch and designer briefcase. She shook her head slightly, thinking he was probably trying to show off wealth he didn't really have. She had worked in this emergency room for over 15 years and had developed what she considered a good sense for reading people. "Ma'am, we're going to take you back for some tests," Dr. Williams told the patient. "Your son can wait in the family area." "Doctor," the man interjected gently, "would it be possible for me to stay with her? She gets anxious in medical settings, and I think my presence would help keep her calm." Dr. Williams turned to face him with an expression of barely concealed annoyance. "Sir, this is a medical facility, not a family reunion. We have protocols to follow. The family waiting area is down the hall." "I completely understand the protocols," he replied patiently. "I was just hoping that given her age and anxiety levels, an exception might be made. I promise I won't interfere with any procedures." "Look," Dr. Williams said, her voice taking on a condescending tone, "I know you think you know what's best for your mother, but we have medical degrees and years of experience. We don't need input from family members who think they know better than trained professionals." The elderly woman, despite her pain, noticed the way the doctor was speaking. To her son, she reached out and grasped his hand weakly. "Don't worry about me, sweetheart. Just do what the doctor says." As they wheeled the patient into the examination room, The man followed at a respectful distance. Dr. Williams was already thinking about the tests she would need to order and the paperwork that would follow. She assumed they probably had basic insurance at best, which meant she would need to be careful about ordering expensive tests that might not be covered. "Before we begin," the man said quietly, "I should mention that my mother had a mild heart attack 3 years ago. She's been doing well since then, but her cardiologist had mentioned that any chest pain should be taken seriously." Dr. Williams looked up from her chart with irritation. "Sir, did I not just explain that we need to examine the patient without interference? Your mother will tell us everything we need to know. She might not remember all the details of her medical history," he explained calmly. "She's been under a lot of stress lately, and sometimes she forgets important information when she's in pain." "We have ways of getting medical history," Dr. Williams replied curtly. "We don't need family members trying to play doctor. Now, please step outside while we examine her." The man hesitated for a moment, looking at his mother's worried face. "Could I at least stay until she's more comfortable? She's clearly frightened." Dr. Williams set down her clipboard with an audible sigh. "Sir, I'm going to ask you one more time to please wait outside. If you continue to interfere with our medical procedures, I'll have to call security." "That won't be necessary," he said quietly, his voice still respectful despite the obvious frustration in his eyes. "I'll be right outside, Mom. Call if you need anything." As he left the room, Dr. Williams shook her head and muttered to one of the nurses, "Some people think they know everything." Probably got his medical degree from Google. The nurse, a young woman named Jennifer who had been working at the hospital for only 6 months, looked uncomfortable with the doctor's comment but said nothing. She had noticed how polite and knowledgeable the man seemed, but she wasn't about to question a senior physician. Outside in the hallway, the man sat in an uncomfortable plastic chair, checking his phone occasionally while keeping an eye on the examination room door. Other family members in the waiting area couldn't help but notice his calm demeanor despite the obvious stress he was under. He answered a few phone calls quietly, speaking in medical terminology that seemed surprisingly sophisticated for someone Dr. Williams had dismissed as just another worried family member. Inside the examination room, Dr. Williams began her evaluation of the patient. The elderly woman was clearly in distress, and the initial tests were showing signs that concerned the doctor. However, she was already forming opinions about the case based on her assumptions about the family's background and socioeconomic status. What Dr. Williams didn't know was that her assumptions were about to be challenged in a way that would change everything she thought she knew about the quiet, respectful man sitting in the hallway, waiting for news about his mother's condition. Inside the examination room, Dr. Williams began attaching monitoring equipment to the elderly patient. The woman's breathing was still labored, and her face showed clear signs of distress. The heart monitor began beeping steadily, showing an irregular rhythm that immediately caught the doctor's attention. "Mrs. Johnson," Dr. Williams said, looking at the chart, "I need you to tell me about your medical history. Have you had any heart problems before?" The elderly woman tried to speak but struggled to catch her breath. I had something a few years ago. My son knows. He keeps track of all my medicines." Dr. Williams rolled her eyes slightly. "Mrs. Johnson, I need to hear this from you, not from your son. Can you remember what happened?" It was my heart," the woman managed to say between breaths. "The doctor said that." Sighed, I needed to be careful. Meanwhile, the man sitting in the hallway could hear his mother's labored breathing through the thin walls. He stood up several times, wanting to help but knowing he would only face more resistance from Dr. Williams. A few other families in the waiting area noticed his obvious concern and stress. An older gentleman sitting nearby leaned over and said, quietly, "First time in the emergency room with a parent?" "It's always scary, son," the man nodded politely. "Yes, it's very worrying. She's been doing so well lately, and then this happened so suddenly." "Doctors know what they're doing," the older man continued. "Just have to trust them and stay out of their way." The man smiled sadly. "You're absolutely right. Sometimes it's just hard to wait when someone you love is in pain." Back in the examination room, Dr. Williams was growing frustrated with the limited information she was getting from her patient. The woman was clearly too distressed to provide a detailed medical history, and the irregular heart rhythm was becoming more concerning. Mrs. Johnson, I'm going to need you to try harder to remember your medications. This is important information. The elderly woman looked confused and frightened. I'm sorry, doctor, I just ... My son has a list. He takes me to all my appointments. He knows everything. Dr. Williams sighed heavily and walked to the door. She opened it and called out in an annoyed voice, Sir, could you come in here for a moment? The man immediately stood up and walked quickly to the room. Is everything okay? How is she doing? Your mother can't seem to remember her medical history or medications. I need you to provide that information, but please don't try to diagnose anything or give medical opinions. Of course, he said, pulling out his phone. I keep all her medical information organized here. She's currently taking metoprolol 50 milligrams. Twice daily for blood pressure, atorvastatin 20 milligrams for cholesterol, and low-dose aspirin. She had an anterior wall myocardial infarction in March 2021. Followed by cardiac catheterization and placement of 2 stents in the left anterior descending artery. Dr. Williams paused her writing and looked up sharply. Excuse me? Could you repeat that? She had a heart attack in 2021. They put in 2 stents during a cardiac catheterization procedure. The cardiologist was Dr. Rodriguez at University Medical Center. Dr. Williams felt a slight unease at how precisely the man had described the medical procedures, but she pushed the feeling aside. How do you know all these medical terms? Did you look them up online? The man looked puzzled by the question. No, I like to understand what's happening with my mother's health. I ask questions during her appointments and take notes. Well, try not to use words you don't fully understand. It can be confusing, Dr. Williams said dismissively. Now, has she been taking her medications regularly? Yes, she's very compliant with her medication schedule. I set up a pill organizer for her every week. She hasn't missed any doses. As Dr. Williams continued her examination, she ordered an EKG and some blood tests. While they waited for the results, the man sat quietly beside his mother, holding her hand and speaking to her in comforting tones. The pain is getting better, Mom. These doctors are going to take good care of you. The elderly woman squeezed his hand weakly. You've always taken such good care of me, sweetheart. I don't know what I'd do without you. Dr. Williams overheard the conversation and couldn't help but make another assumption. Probably lives with his mother because he can't afford his own place, she thought. It was becoming a pattern in her mind. Each observation seemed to confirm her initial judgments about this family when the EKG results came back. They showed some concerning changes from the patient's baseline. Dr. Williams studied the printout and frowned. The blood test results would take a little longer, but she was already considering the possibility that this might be another cardiac event. Mrs. Johnson, she said, I'm seeing some changes on your heart rhythm test. We're going to need to keep you here for observation and run some additional tests. The man leaned forward with concern. Doctor, could you explain what kind of changes you're seeing? Is it similar to what happened during her previous heart attack? Dr. Williams shot him an irritated look. Sir, I just told you not to use medical terms you don't understand. This is a completely different situation. I'm sorry, I just want to understand what's happening. When you say changes, could you be more specific about what that means for her treatment? It means we need to do more tests, Dr. Williams replied curtly. I don't have time to explain every medical detail to family members. That's not how hospitals work. The man fell silent, but his mother noticed the tension in the room. Despite her pain and medication, she could sense that something wasn't right about how her son was being treated. Doctor, the elderly woman said weakly, my son isn't trying to cause trouble. He just worries about me. He's always been very smart about these things. Dr. Williams turned back to her patient with a forced smile. Mrs. Johnson, I understand that family members worry. But medical professionals need to focus on medical care, not on explaining every detail to people who won't understand it anyway. The man's jaw tightened slightly at this comment, but he remained silent. He continued to hold his mother's hand, but other staff members in the room were beginning to notice the unusual tension between the doctor and the family member. Jennifer, the young nurse, had been watching the interactions with growing discomfort. She had noticed how articulate and knowledgeable the man seemed about medical procedures, and she couldn't understand why Dr. Williams was being so dismissive of someone who was clearly just concerned about his mother. "Dr. Williams," Jennifer said quietly, "the blood test results should be back in about 20 minutes. Should I set up for a cardiac enzyme panel as well?" "Yes, and let's get a chest x-ray too," Dr. Williams replied. Then she turned to the man. "Sir, we're going to be doing several more tests. This is going to take a while, so you might want to go get some coffee or something to eat. I'd prefer to stay with my mother, if that's okay. She gets anxious when she's alone in medical settings." Dr. Williams looked at him with barely concealed annoyance. "Fine, but please don't interfere with any procedures. And don't ask questions about every little thing we do. We know our jobs." As the medical team prepared for the additional tests, the man sat quietly in the corner of the room, occasionally checking his phone. Unknown to Dr. Williams, he was receiving text messages from colleagues asking about his mother's condition and offering assistance. He responded briefly to each message, using medical terminology that would have surprised the doctor if she had bothered to pay attention. The elderly woman, despite her discomfort, continued to observe how her son was being treated. She had raised him to be respectful and polite, which he was demonstrating even in the face of obvious disrespect. But she also knew something about her son that Dr. Williams had no idea about, and she was beginning to feel angry about the way the medical staff was treating him. What none of them knew was that this uncomfortable situation was about to take a dramatic turn that would change everything. The blood test results had just arrived when the emergency room doors opened again. This time, a distinguished-looking Hispanic man in his 50s walked in, wearing scrubs under a white coat. His confident stride and the way the nursing staff immediately straightened up when they saw him made it clear that this was someone important. Dr. James Rodriguez, the chief of cardiology, had been called in for a consultation on a complicated case in the cardiac unit. As he walked past the emergency room, he heard familiar voices and decided to check what was happening. He had been working late, reviewing patient files in his office when he got the call, but something about the conversation he overheard made him pause. Jennifer, the young nurse, was the first to notice him. "Dr. Rodriguez, good evening. Are you here for a consultation?" "Actually, I was just passing by and heard some discussion about a cardiac case. Thought I'd see if you needed any input." He glanced around the room, and his eyes landed on the man sitting quietly beside the elderly patient's bed. His face immediately lit up with recognition. "David, what are you doing here?" Dr. Rodriguez said with genuine warmth and surprise. The man looked up from his mother's bedside and smiled for the first time since arriving at the hospital. "James, thank God you're here. Mom started having chest pains earlier tonight. They've been taking good care of her, but I'm worried it might be similar to what happened 3 years ago." Dr. Williams, who had been reviewing test results at the nurse's station, looked up sharply when she heard the interaction. She watched in confusion as Dr. Rodriguez approached the man she had been dismissing all night and embraced him like an old friend. "How long has she been here?" Dr. Rodriguez asked, immediately switching into professional mode while maintaining his warm tone toward David. "About 2 hours now. The chest pain started suddenly while she was watching TV. Classic presentation. Crushing pain radiating to the left arm, shortness of breath, nausea. Dr. Williams has been very thorough with the initial workup." Dr. Rodriguez nodded, then turned to the elderly woman with a gentle smile. "Mrs. Thompson, I'm Dr. Rodriguez. Your son and I work together. How are you feeling right now?" The elderly woman's face brightened despite her discomfort. "Oh, my David, he's such a good boy, always taking care of everyone." "He certainly is," Dr. Rodriguez replied, then looked at the heart monitor and frowned slightly. "David, what does the EKG show?" There are some Saint segment changes in leads 2, 3, and EVF. Troponin levels are elevated, but not as high as during her STEMI 3 years ago. I'm thinking it might be a non-Saint elevation me, but the enzyme levels are still climbing. Dr. Williams felt her stomach drop as she listened to this conversation. The medical terminology that David was using wasn't just basic knowledge. It was the kind of detailed understanding that only came from years of medical training and experience. She walked over slowly, trying to understand what she was witnessing. Dr. Rodriguez, do you know this family? Dr. Rodriguez looked at her with slight surprise. Family? Dr. Williams, I'd like you to meet Dr. David Thompson, one of the finest cardiovascular surgeons I've ever worked with. David, this is Dr. Williams, from our emergency department. The words hit Dr. Williams like a physical blow. She felt the color drain from her face as the reality of the situation crashed down on her. The man she had been treating with condescension and dismissal for the past 2 hours wasn't just any concerned family member. He was a doctor. Not just any doctor, but a cardiovascular surgeon. Dr. Thompson, she managed to say, her voice barely above a whisper. The title felt foreign coming from her lips, considering how she had been addressing him all night. David stood up and extended his hand politely, just as he had done when they first met hours earlier. Please call me David, and thank you for taking such good care of my mother tonight. Dr. Williams stared at his outstretched hand, remembering how she had ignored this same gesture earlier. Her mind was racing, trying to process the implications of what she had just learned. Every interaction from the past 2 hours was replaying in her head, and she felt sick thinking about how she had treated him. I had no idea, she stammered, finally shaking his hand. There was no reason you should have, David replied graciously. I'm just here as a son tonight, not as a doctor. Dr. Rodriguez looked between them, sensing the tension in the air. Is everything all right here? Everything's fine, David said quickly, clearly not wanting to create any drama. Dr. Williams has been very professional, but Dr. Rodriguez was experienced enough to read between the lines. He had noticed the uncomfortable expressions on the nursing staff's faces and the way Dr. Williams seemed shaken. As chief of cardiology, he had seen this kind of situation before, and he could guess what had happened. Jennifer, the young nurse, couldn't stay silent any longer. Dr. Rodriguez, I think there might have been some misunderstandings earlier. What kind of misunderstandings? Dr. Rodriguez asked, his tone becoming more serious. David immediately stepped in. James, please, it's not important. Let's just focus on my mother right now. But Mrs. Thompson, despite her condition, had been listening to the entire conversation. The medication had helped with her pain, and her mind was clearer now. She looked directly at Dr. Williams with a mixture of disappointment and sadness. Dr. Williams, the elderly woman said softly, my son has been nothing but respectful to you all night. But you treated him like he didn't matter, like his concerns weren't valid. I may be old and sick, but I'm not blind. The room fell silent. Dr. Rodriguez looked at Dr. Williams with a questioning expression, while the nursing staff tried to busy themselves with other tasks to avoid the uncomfortable moment. Dr. Williams felt her face burning with shame. Mrs. Thompson, I apologize. If I seemed... You seemed like you had already decided who my son was before you even spoke to him. The elderly woman continued, her voice gaining strength. And you were wrong. Dr. Rodriguez was beginning to understand what had happened. As a Hispanic doctor who had faced his own share of prejudice throughout his career, he recognized the signs. He had seen talented colleagues treated unfairly based on assumptions about their background or appearance. Dr. Williams, he said quietly, perhaps we should discuss this privately later. Right now, let's focus on Mrs. Thompson's care. David looked grateful for Dr. Rodriguez's intervention. James, what's your assessment of the situation? I'm obviously too close to this case to be objective. Dr. Rodriguez examined the test results and the monitor readings. Based on what I'm seeing, I think you're right about the NSTM. The enzyme levels are concerning. But they're not at the critical levels we saw during her previous event. I'd like to get her up to the cardiac unit for closer monitoring and possibly a cardiac catheterization in the morning." "That sounds like the right approach," David agreed. "Should we start her on additional antiplatelet therapy?" "Already thinking ahead," Dr. Rodriguez smiled. "This is why you're such a good surgeon, David. Yes. Let's get her started on clopidogrel and increase the metoprolol dosage." As they discussed the treatment plan, Dr. Williams stood nearby feeling completely out of her depth. These two doctors were having a conversation at a level that demonstrated David's extensive knowledge and experience. She realized that not only had she misjudged him completely, but she had also dismissed someone who was far more qualified than she was to assess. This cardiac case, other emergency room staff members had begun to gather nearby, having heard about the situation. Word was spreading quickly through the hospital that the man Dr. Williams had been treating dismissively all night was actually Dr. David Thompson, whose reputation in cardiovascular surgery was known throughout the medical community. Jennifer approached Dr. Williams quietly. "Doctor, I tried to say something earlier. He seemed to know so much about medical procedures, but I didn't want to question your judgment." Dr. Williams nodded numbly, realizing that even the nursing staff had noticed David's medical knowledge while she had been blinded by her own assumptions and prejudices. As preparations began to transfer Mrs. Thompson to the cardiac unit, David turned to Dr. Williams one more time. "Thank you again for your care tonight. I know emergency medicine is challenging work, and I appreciate everything you've done for my mother." His graciousness in the face of how she had treated him only made Dr. Williams feel worse. She was beginning to understand that this wasn't just a case of mistaken identity. It was a revelation about her own biases that she would have to face. As Mrs. Thompson was being prepared for transfer to the cardiac unit, Dr. Rodriguez pulled David aside for a private conversation. Dr. Williams couldn't help but overhear as they walked to a quiet corner of the emergency room. "David, I have to ask, how are you doing?" "I know how stressful it can be when it's your own family member," Dr. Rodriguez said with genuine concern. David ran his hand through his hair, showing the first real signs of exhaustion since he had arrived. "Honestly, James, I'm worried. The presentation tonight was very similar to her heart attack 3 years ago. I keep second-guessing myself, wondering if I should have brought her in sooner." "You did exactly the right thing," Dr. Rodriguez assured him. "The fact that you caught it early probably prevented a much more serious event. Speaking of which, I heard through the medical community grapevine that you've been making quite a name for yourself at University Medical Center. Congratulations on the promotion, by the way." Dr. Williams felt her heart sink even further. "Promotion? What promotion?" David smiled modestly. "Thank you. The new position has been challenging but rewarding. Taking over as Director of Cardiovascular Surgery is a big responsibility, but I'm excited about the research opportunities it's opening up." Director of Cardiovascular Surgery. The words echoed in Dr. Williams' mind like a death sentence. Not only was David a doctor, not only was he a surgeon, but he was the director of an entire department at one of the most prestigious medical centers in the state. "I saw your paper in the Journal of Cardiac Surgery last month," Dr. Rodriguez continued. "The outcomes data on your minimally invasive valve repair technique was impressive. Have you started implementing that protocol here?" "We've done about 30 cases so far with excellent results. The recovery time has been cut in half compared to traditional approaches," David replied. "I'm hoping to present the full data at the American Heart Association conference next year." Dr. Williams leaned against the wall, feeling dizzy. She was listening to two doctors discuss cutting-edge surgical techniques and research that was being published in major medical journals. The man she had dismissed as an ignorant family member was apparently a leading expert in his field. Jennifer walked over to where Dr. Williams was standing. "Doctor, are you okay?" "You look pale." "I'm fine," Dr. Williams managed to say, though she clearly wasn't. Meanwhile, other staff members in the emergency room were beginning to piece together what had happened. Word was spreading quickly through the hospital, and not in a way that reflected well on Dr. Williams. "Did you hear about what happened in the one of the orderlies was saying to another. Dr. Williams spent all night treating Dr. Thompson like he was just some random guy off the street. Dr. Thompson, the heart surgeon from University Medical? The one who was on the cover of Medical News Today last month? The same one. Apparently, he brought his mother in with chest pains, and Dr. Williams had no idea who he was. The conversation was overheard by several other staff members, and soon the story was making its way through different departments of the hospital. Each retelling seemed to make Dr. Williams look worse and highlight David's impressive credentials. Back in the emergency room, David was checking his phone and responding to messages. Dr. Rodriguez noticed his colleague's distraction. "Work calling?" Dr. Rodriguez asked. "Actually, yes. I have a complex surgery scheduled for tomorrow morning, a triple vessel bypass on a 78-year-old patient. My surgical team is checking in about the preoperative preparations." David looked at his mother, who was resting more comfortably now. "I'm hoping I'll still be able to perform the surgery. The patient has been waiting for 3 weeks. Dr. Rodriguez nodded understandingly. "That's the burden of being in our position. The work never stops, even during family emergencies. But your mother is stable now. I think you'll be able to keep your surgical schedule." Dr. Williams overheard this conversation and felt another wave of shame wash over her. Here was a man who had spent the entire night worried about his mother's health, dealing with her disrespectful treatment, and he was still thinking about his responsibilities to other patients who needed his expertise. As if the situation couldn't get any worse for Dr. Williams, Dr. Rodriguez's phone rang. He answered it quickly and his expression became serious. "Yes, I understand." "Yes, he's here." "With me now?" Dr. Rodriguez looked at David. "David, that was Dr. Peterson from University Medical. Apparently word has gotten out about your mother's condition. He wanted to make sure you have everything you need and to let you know that they've rearranged the surgical schedule if necessary." "That's very kind of him," David replied. "Please tell him I appreciate the concern, but I think we'll be okay to proceed as planned." Dr. Williams realized that David wasn't just any doctor at University Medical Center. He was important enough that the department head was personally calling to check on him. She had treated someone with that level of professional standing like he was. Nobody. The reality of David's true identity was becoming clearer with each passing minute. Jennifer had looked him up on her phone and was quietly sharing what she found with other staff members. "Look at this," she whispered to another nurse, showing her phone screen. "Dr. David Thompson, Director of Cardiovascular Surgery at University Medical Center. It says here he's performed over 2,000 heart surgeries and has published 47 research papers. He graduated top of his class from Harvard Medical School. Harvard Medical School?" The other nurse whispered back. "And Dr. Williams was treating him like he didn't know anything about medicine?" The whispered conversations were becoming harder to ignore, and Dr. Williams could feel the eyes of her colleagues on her. She had worked at this hospital for 15 years and had built a reputation as a competent emergency room doctor. Now, in one night, that reputation was crumbling because of her own prejudices and assumptions. David noticed the uncomfortable atmosphere in the room and made a decision. He approached Dr. Williams directly, speaking quietly so others couldn't hear. "Dr. Williams, I want you to know that I hold no hard feelings about tonight. Emergency rooms are stressful places and mistakes happen. I hope we can move forward professionally." His gracious words only made Dr. Williams feel worse. "Dr. Thompson, I owe you a sincere apology. I made assumptions that were completely inappropriate and unprofessional." "I appreciate that," David said simply. "What matters most is that my mother received good care, and she did." But Dr. Williams knew that the damage went far beyond just their personal interaction. Her behavior had been witnessed by multiple staff members, and in a hospital environment, news traveled fast. She was already imagining the conversations that would happen in the break rooms and cafeteria over the next few days. As Mrs. Thompson was finally wheeled toward the cardiac unit, she squeezed her son's hand and looked directly at Dr. Williams. "Dr. Williams," the elderly woman said, "I hope you learned something important tonight." My son has always been special, but not because of his job or education. He's special because of how he treats people with kindness and respect, even when they don't treat him the same way. The words were spoken gently, but they carried a weight that hit Dr. Williams harder than any harsh criticism could have. This elderly woman, despite her medical emergency, had been observing everything and had drawn her own conclusions about what she had witnessed. As the family disappeared down the hallway toward the cardiac unit, Dr. Williams was left standing in the emergency room, surrounded by colleagues who now knew the truth about what had happened. She realized that this night would be talked about for years to come, not as an example of good emergency medicine, but as a cautionary tale about the dangers of making assumptions about people based on their appearance. The night shift was almost over, but Dr. Williams knew that the real consequences of her actions were just beginning. Word would spread beyond the hospital walls, and her professional reputation would suffer. More importantly, she would have to face the uncomfortable truth about her own biases and prejudices that had led to this humiliating situation. 3 days had passed since that unforgettable night in the emergency room. Mrs. Thompson was recovering well in the cardiac unit, and the additional tests had confirmed that she had indeed suffered a mild heart attack. Thanks to the quick treatment she received, there was no permanent damage to her heart muscle, and her doctors were optimistic about her complete recovery. David had been able to perform his scheduled surgery the next morning, successfully completing the triple bypass operation he had mentioned to Dr. Rodriguez. Despite the stress of his mother's emergency, his hands had been steady and his focus sharp, demonstrating the professionalism that had made him one of the most respected surgeons in the region. Dr. Williams, however, was struggling with the aftermath of that night. She had barely slept since the incident, replaying every interaction over and over in her mind. The story had spread throughout Metropolitan Hospital, and she could feel the changed atmosphere whenever she walked through the corridors. During her lunch break, she sat alone in the cafeteria, picking at her sandwich while overhearing conversations at nearby tables. The incident had become a talking point throughout the hospital, though most people were discussing it in hushed tones. "I heard he never once raised his voice or complained, even when she was being rude to him," one nurse was saying to her colleague. "That's the mark of real class," the other replied. "A lesser person would have made a scene or demanded to speak to a supervisor." Dr. Williams pushed her food around on her plate, knowing they were talking about David and her. She had lost her appetite completely and was considering going home. Early when someone sat down across from her, it was Dr. Rodriguez. "Patricia, how are you holding up?" he asked with genuine concern. She looked up at him with tired eyes. "Honestly, James, I feel terrible. I keep thinking about how I treated him, and I can't believe I was so blind to my own prejudices." Dr. Rodriguez nodded thoughtfully. "I've been thinking about our conversation the other night. This kind of thing happens more often than we'd like to admit in healthcare. Unconscious bias affects all of us, but the key is what we do after we recognize it." "I don't know where to start," Dr. Williams admitted. "I've been a doctor for 15 years, and I thought I was better than this. I thought I treated all patients and families with respect, but obviously I was wrong." "The fact that you're reflecting on this shows character," Dr. Rodriguez said. "David could have made a huge scene that night. He could have demanded to speak to administration or filed a complaint. Instead, he chose to focus on his mother's care and handle the situation with grace." Dr. Williams nodded, feeling even worse about her behavior. "He was so professional about it. Even after I found out who he was, he didn't make me feel bad or try to embarrass me further." "That's who David is," Dr. Rodriguez explained. "I've known him for 8 years, and he's always been like that. He believes in treating everyone with dignity, regardless of their position or background. It's one of the reasons he's so respected in the medical community." Later that afternoon, Dr. Williams made a decision. She had been thinking about it for days, and she knew she had to do something more than just feel sorry for herself. She walked up to the cardiac unit and asked the nurse at the desk if Mrs. Thompson was accepting visitors. "Let me check," the nurse said, disappearing into the room. A moment later, she returned with David. Dr. Williams, David said, looking surprised but not unwelcoming. How can I help you? I was hoping I could speak with you and your mother, if she's feeling up to it, Dr. Williams said nervously. I have something I need to say. David studied her face for a moment, then nodded. She's doing much better today. Come on in. Mrs. Thompson was sitting up in bed, looking much more alert and comfortable than she had 3 nights earlier. Her color had returned, and she was even managing to smile when Dr. Williams entered the room. Mrs. Thompson, I'm so glad to see you're feeling better, Dr. Williams began, her voice shaking slightly. Thank you, doctor. The care here has been wonderful, the elderly woman replied graciously. Dr. Williams took a deep breath. Mrs. Thompson, I came here to apologize to both you and your son. My behavior the other night was unprofessional and inexcusable. I made assumptions based on nothing more than prejudice, and I treated your son with disrespect that he absolutely did not deserve. Mrs. Thompson looked at her son, then back at Dr. Williams. Doctor, I appreciate you coming here to say that. I've been thinking a lot about what happened, Dr. Williams continued. I realized that I've probably been making similar assumptions about other patients and families without even realizing it. That's not the kind of doctor I want to be. David spoke up quietly. Dr. Williams, we all have unconscious biases. What matters is recognizing them and working to change. I've experienced situations like this before, unfortunately. You have? Dr. Williams asked, surprised. More often than I'd like to admit, David said with a sad smile. There have been times when I've walked into hospitals wearing scrubs and people have assumed I was a technician or an orderly instead of a doctor. There have been patients who've requested a different surgeon when they found out their doctor was a black man. Mrs. Thompson reached over and patted her son's hand. He's always handled it with such grace. I taught him that you can't control how people treat you, but you can control how you respond. Dr. Williams felt tears welling up in her eyes. I'm so sorry. You shouldn't have to deal with that, especially not from other medical professionals who should know better. The important thing is that you're here now, acknowledging what happened, David said. That takes courage, and it's the first step toward change. Over the next few weeks, Dr. Williams began making changes in her own practice and in the hospital culture. She volunteered to help develop a bias training program for the emergency department staff. She also started paying closer attention to her own assumptions and reactions. When treating patients from different backgrounds, Jennifer, the young nurse who had witnessed the original incident, became one of Dr. Williams' strongest supporters in implementing these changes. I'm proud of you for addressing this head-on, Jennifer told her. A lot of people would have just tried to forget it happened. The bias training program that Dr. Williams helped develop became a model for other departments in the hospital. During one of the training sessions, she shared her own story about the night she met David, using it as an example of how unconscious bias can affect patient care. I thought I was treating everyone equally, she told the group of doctors and nurses, but I realized that I was making judgments about people before I even spoke to them. We all do it, but we have to be honest about it if we want to change. David was eventually invited to speak at one of the training sessions. He talked about his experiences as a black doctor in predominantly white medical settings and offered practical advice for creating more inclusive healthcare environments. The goal isn't to be colorblind, he explained to the group. The goal is to see people fully and treat them with dignity, regardless of what assumptions we might make about their background. After his presentation, many of the staff members approached him with questions and comments. Dr. Williams watched from the back of the room, amazed by his ability to turn a negative experience into an opportunity for positive change. Following the training sessions, Metropolitan Hospital implemented new policies designed to reduce bias in patient care. These included regular diversity training, peer review processes that specifically looked for signs of discriminatory treatment, and patient feedback systems that allowed families to report concerns about bias. 6 months after that difficult night in the emergency room, Dr. Williams received an unexpected phone call. It was David, asking if she would be interested in participating in a regional conference on healthcare equity that he was organizing. "I think your perspective would be valuable," he explained. "You've done important work in addressing these issues, and other healthcare professionals could learn from your experience." Dr. Williams was honored by the invitation and accepted immediately. At the conference, she spoke about her journey from unconscious bias to active advocacy for change. Her presentation was well received, and many audience members approached her afterward to share their own experiences and ask for advice. Mrs. Thompson made a full recovery and returned home after a week in the hospital. She sent Dr. Williams a handwritten thank you note, not just for the medical care she received, but for the personal growth and positive changes that had resulted from their difficult first meeting. "Sometimes the most important lessons come from our most uncomfortable moments," Mrs. Thompson wrote. "I'm proud of the doctor you've become since that night." The incident that had initially seemed like Dr. Williams' worst professional moment had transformed into an opportunity for growth, learning, and positive change that extended far beyond just one hospital or one doctor. It became a reminder that even our mistakes can become sources of wisdom if we're willing to face them honestly and work to do better.